friends, I am Dr Sadeep. I am a homeopathic consultant. So in this channel, we will be taking up the homeopathic subjects in depth, and I will be explaining the facts with a simple language and make the people understand that how homeopathy works. So if you are a homeopathic student or a homeopathic doctor, please join our channel and we will make a together effort to create a homeopathic faculty and mastery touch to the practicing aspect. In this channel, I will be taking up the academic interests also and practical interests also. So today I am talking about this homeopathic aggravations. So in the last video, I have already discussed about this homeopathic aggravations, as Dr. Hahnemann tells in his aphorism 157, 158, 159 and 160th aphorism. So the Kent's approach of this homeopathic aggravation is little bit different, and he will give a broader spectrum of understanding about the homeopathic aspect. The two masters, that is Dr. Hahnemann and Dr. Kent, has a very depth understanding of these principles. The homeopathy is based on natural principles, as you know. So Hahnemann, when he wrote his aphorisms, he had a very deep understanding of the nature. Then only he wrote these aphorisms, and he left these aphorisms to use as a principles. Dr. Kent, in his lecture in a philosophy, he will talk about homeopathic aggravation and starts with the 154. So Dr. Hahnemann tells homeopathic aggravation in 157, 158, 159 and 160 aphorism, but Dr. Kent takes this homeopathic aggravation little bit previously, that is 154 he starts with. So in 154, Dr. Hahnemann is telling that when there is an acute disease, there will be a mild aggravation and the disease will be cured even with a single dose or a very minute and a matching drug. The medicine will cure the disease. He will be telling in the 154th aphorism. So 155 and 156 aphorisms, what he is telling is, whenever there is a chronic disease responding to the symptom similarity of the medicines, then there will be aggravations which you must take care. He will be telling in this 155 and 156 aphorisms. So Kent starts with 154 only, and he explains, if it is an acute disease, nothing to be worried about. It will be cured by a little effort and a little smaller medicine, that is to say with a very mild medicine the disease will be cured. But only the problem comes with the chronic states. Dr. Kent, he explains with an examples that whenever there is a aggravation in the chronic disease, when the medicine is given with the totality of the patient is reached and the medicine is given in the minutest form, then the aggravation then the aggravation also occur in the chronic patients. There are two things happening in the chronic patients, Dr. Kent explains. How is that is? What is that is? Kent explains that whenever there is a chronic case and with that a symptom similarity medicine is given in a very smallest quantity, also produces a reaction in the patient. He differentiates two things in homeopathic aggravations. He talks about body reaction and homeopathic aggravations. First, I will explain you what exactly Kent means by body reaction. That is medicine reaction or response to the remedy given by the homeopathic doctor to the patient. How he reacts for the medicine given, symptom similarity medicine given. So Kent explains that whenever there is a deep-seated chronic disease, if the patient has gone with a prolonged suffering and the organal changes or the tissue damage or any irreversible damage has occurred in the organs, if you give a very higher potency with symptom similarity matching, then the vital force will be responding accordingly, and the body will start cleaning the things and regenerating the organs or the tissues damaged or which are not in a position to come to the healthy state. In that condition, body will respond in a reaction way. That is to say, when lungs are being damaged, when digestive tract has been damaged, when kidney are being damaged, the patient will show the symptoms of vomiting, show the symptoms of diarrhea, show the symptoms of sweating suddenly, and the body will be cleaning itself. So Kent will be talking in this way. If the disease is very chronic and if the disease has reached the uncurability state, or if the disease has pathology in itself, then all this will be following in the chronic diseases. Kent will be explaining all this with a few examples. So one or two examples what Kent has explained is, so whenever there is a very chronic disease which is followed after giving of the symptom similarity medicine, patients starts vomiting, patients starts with diarrhea, and patients starts with purging and loose motions. So you must know, or the homeopathic physician must know, that the body is cleaning itself. So you must not interfere in between the reaction of the body, or you must not choose a different medicine to suppress that body reaction. For the primary medicine, whatever you have chosen is symptom similar. Kent also requests, or he will tell to the physician who is very intelligent and who knows the homeopathic in depth, to be cautious of knowing about the drug reaction and the medicine call for a different medicine in this homeopathic aggravation, friends. And Dr. Kent also explains in 150th aphorism, he also tells the same thing with a different examples. What examples he is giving is, when there is a chronic state in a patient who is paralyzed, and you have reached a symptom similarity medicine, and if you have reached a potency which is very suitable for him, then there is a possibility of this paralyzed patient getting tingling, numbness, itching and many other sensation and symptoms in the paralyzed limb, so that the life is coming back into the nerves, into the skin, into the muscles of that paralyzed limb. So this is a drug reaction, that is, drug has produced a good effect on the body parts to regenerate the dead cells. So you must be aware of this, Dr. Kent is telling in his philosophy, friends. And he is telling another one example of a child which is totally bedridden for longer period, having seizures, and the child is in coma. When you give a symptom similarity medicine, so that the itching in the scalp starts, tingling in the scalp starts, the child starts crying violently, so that the medicine has produced a good effect on the child, and this drug reaction or the drug action, if you want to tell, it has started. The homeopathic physician must understand drug action and drug reaction properly. Both are not different. I am telling drug action as drug reaction also. The allopathic standpoint of view, reaction means it's a side effect, they will tell. But in our homeopathy, the drug reaction or the drug action means, this is all what I am explaining today, friends. So these are the two examples Dr. Kent has given. And in 158th aphorism, how he goes and talks about this is the same drug reaction he is telling, remedy reaction, and what is the call for another remedy, you must understand, he is telling. And in that he is telling, homeopathic physician must understand the constitution of the physical makeup of a patient. So he tells about two constituents, that is oversensitive patient and a person who is robust and he has a vital power to regenerate the organs, to regenerate the cells. If the vital force is very weak, if the patient vital force is very weak and he is oversensitive, he will be coming across all the medicines, whatever you give, he will start proving the medicines. In those conditions, the dosing must be thought of, or the dosing must be given according to the oversensitive patient. That is very small medicine, very minimal dose to be chosen for that patient. So in a robust constituency or the robust constitution of a patient, then you can give a proper medicine in a little higher dose also. That is to say, in a minimal dose, if you give also, he will tolerate the effect of the reaction of the body. So this he will be talking in his philosophy, friends. And he will be telling that whenever a physician is having a good knowledge of materia medica, posology, and eliciting of the symptoms properly and finding the proper symptom similarity medicine, then a physician will be capable of curing any acute or any chronic disease with a single medicine or with a single remedy. When the physician does not have, he is not well equipped with the knowledge of materia medica and the philosophy and the posology, he will be struggling and giving 2-3 medicines which is partially suited, and he will be capable of curing the disease. So he is telling in his philosophy. So in 158 he is telling all this. 159, what he is telling is, again he is telling and stressing about the minuteness of the dose. So minuteness of the dose according to Kent and according to Hahnemann is same. According to Kent, what he is telling is, one of the fact about Dr. Kent is he never used crude medicines. He always used higher potentized medicine up to cm and mm. That is highest possible potencies Dr. Kent has used, and in his experiences he tells that crude medicines are exactly as poisons. So he is telling in his explanation, in his philosophy, that we are, homeopathic physicians, or the homeopathic standpoint of this poisonous drug and the potentized drug are to be understood in this way. Whenever there is a crude form of medicine is there, he considers that as a poison. Whenever the highest potentized form of a crude form, he considers it as a medicinal value medicine. If not, the medicine will act very drastically and causes death. He will be telling in his philosophy, friends. So he will be telling crude medicines are always poisonous. Crude medicines must never be used. You must use as much as higher potencies and cure the patient. And in 160th aphorism, what he is ultimately telling is, the doses must be very minimal. Higher the higher you go, the symptom similarity, if you match, there is a good chance that you will cure the patient. So always he stresses on the symptom similarity of the medicine. That is to say, always you must be a keen observer and find a symptom similarity medicine. This is the first option you must do. Then comes the dosing. That is, always the dosing comes secondary to the symptom similarity of the medicine. He will be telling in his explanation about 160th aphorism, symptom similarity or the homeopathically chosen correct medicine is very, very important. It comes in the first place first, then comes the dosing. So in dosing also he mentions that our standpoint of dose is very large dose. So if you consider allopathic into consideration, he tells that all allopathic medicines which are in crude form are killing the patients. His opinion is like this friends. So in 160th aphorism, he explains about these two things, friends. That is accuracy of the medicine. Medicine must be very accurately chosen homeopathically, he tells. And second comes the dosing part. In dosing part, very minimal dose will be very effective on the patients. And he also goes on explaining that if a patient is aggravated by 200 centesimal dose, and he is aggravated by 1 m dose, and he is aggravated by 10 m dose, so what he is telling is, if you go on minimizing the doses also, if he is aggravating, he requires more higher potency. Dr. Kent is insisting on this point, friends. So wherever you require a minimal dose, you must go to the higher potency. Dr. Kent is explaining in his philosophy, friends. So this is all about the Kent's explanation of these aphorisms. So in summary, what I want to tell is, there are only two aspects you must be very considering in this homeopathic aggravations. So in acute diseases, there is no much to be thought of, because in acute medicines, in acute diseases, the disease will annihilate by itself. If you give an accurate medicine chosen, the potency must be as low as possible. So if we can consider 30 and above, that is 200, 1 m, it will be acting in the patient. The two things you must keep in mind is sensitivity of the patient, constitution of the patient, and disease similarity. If all these three, if you can match, and the pace of the disease, as you consider in the totality of the medicines, pace of the disease is also very important. Accordingly, if you find a medicine and give to the patient in a very minimal dose, the patient will recover very fast, and you will find a mild aggravation in the acute disease, and you will be very happy to know that the patient is cured. In chronic disease, the problem comes. So in chronic disease, what you must do is, you must take the case properly and find the symptom similarity medicine, then go with a higher potency and try to cure the patient in a proper way. In these chronic patients only, Dr. Kent is explaining that whenever you give a medicine, you must understand when the second prescription is to be done, when there will be a call for the second medicine is done. If you understand these two things, then it will be very easy in your daily practice, friends. So this is all summary of this Kent's view of homeopathic aggravation. If you like this video, please share this video, subscribe to our channel. I will be bringing all these informations to you, so that it will be rising your confidence. And please like, share and subscribe. If you have any doubts, please comment in our section. I will try to answer those comments. I have done so many videos on this homeopathic subjects. If you are a student or a homeopathic doctor, please go and watch in the playlist, and in my description also I will be adding in the links. We'll meet you in the next session.